Kia ora.
Kia ora, welcome everybody. You'll notice, kia ora Trish.
Good to
You'll
see
notice,
you.
you too. Hey, you'll notice as you arrive in the room, everybody, that you're automatically on mute. We've got a big agenda today. So welcome everybody. Thank you for being on time. It's 10 o'clock. And so if that's okay with everybody, I'm going to start the meeting on time. I'm going to start with a karakia, and I see that Argentina is not able to hear. So Argentina, thank you for going out and coming back in and see how that goes. Kia ora koutou. So, ko hine moa ho, I'm hine moa from Waitakere Health Link, and I'm going to be just guiding us through the agenda today. That's my role here today. And so as part of that, yeah, let's get started. Let's get started. I would like to offer karakia for all those who are near and far today. And I offer this karakia on behalf of all of us with the intention of thinking about those in our community, in our region, and in our country who have been through a lot. Yeah, we haven't got time to cover all of that, but I want you to know that that is the intention. That is the intention we hold as we give this karakia today. It's amazing that you could all be here today and that we can come together at a time like this. So here is my karakia with the intention of holding people and holding the important work that we do here today. So me noi tātou, let us give thanks. Io ki te rangi, io ki te whenua, io ki ngā tangata katoa, tūturu whakamaua kia tīna, haumi e, hui e, tāhiki e. So kia ora koutou, peace to the land, yeah, peace to the skies, and peace to every single one of us. Yeah, that's the karakia for today. So no mai hara mai ki tēnei hui, the Community Health Services meeting. We've got a big agenda today. So I just want to run through some of the tikanga, the way that the meeting is going to be run. First of all, it's just amazing to see you all here. We've got a great turnout today. We've got a big agenda. I just want to remind you all that this meeting, we will be recording so that we can capture the presentations today so that we can put them up online. So what you share here today will be captured so that others can access this important information that you'll share. One person from each organisation that is on the agenda will present, and the presentations will be timed to about 1 minute 30 seconds. And for those of you who have been in the big room before, you'll understand that 1 minute 30 seconds really is applied. So so if you're sharing anything as part of your presentation, just know that that's part of the timing. So kia ora. We'd love you to put your name if you haven't got it already, and your organisation up on the screen. That will help others to identify you. If you have questions during the kōrero, during the presentations, please just write those in the chat. When it is your turn to present, please just come up off mute, and then you will, Tracy, kia ora Tracy, who's over there with her hand up, will be doing the timing. So please don't be surprised if all of a sudden you sound quiet. That will mean that you're over 1 minute 30 in some way. Okay, and it's not our intention. We know the information is important, but it's about creating space for everybody. Kei te pai? Kei te pai, when I use it in this instant, means is that good? And thank you. I can see some thumbs up and some head shaking. Thank you, Jonathan. Kia ora. Okay, so if you've got your name and your organisation up there, thank you. People will be able to connect with you through the chat. That is the way that we're going to manage the people in the room today, so that we can all connect, because that is the point of today, is staying connected, sharing information, and updating you on the things that are happening in our community. Right, so ka pai, Tracy? Excellent. So just if you come off, just say your name, Tracy, just so people know who you are.
I'm Tracy. Welcome, everybody. Nice to see you.
Kia ora. Kia ora. Thank you, Tracy. And right, what I'm going to do ask now is we have in our meeting today, we have quite a few staff attending. Yeah, we have quite a few staff attending today. So what I'm going to ask you to do is to raise your virtual hand. Yeah, if you have a look in your reactions, you'll see that there's a raise hand, yeah, option. So if you can raise hand, kia ora Fiona, kia ora, welcome. If you're from the hospital, if you're from the DHB, can you just raise your hand, please? Raise your virtual hand, which will mean you'll go to the top of the screen. Kia ora Marion, ka pai Samantha, welcome. Excellent. So we've got a couple of minutes, and if you'd like to, Marion, would you just like to come off? I see you've got a mask on there. Just introduce yourself. Welcome, Marion.
Hi, I'm Marion. I'm the church nurse in the hyperbaric unit down in, so part of Waitakere, but down in Devonport.
Down at Devonport, based at Devonport. Thank you. Thank you, Marion. Excellent. Welcome. Welcome. Anybody else from the staff there? Samantha, and I'm not sure, is it Jenny? Just welcome. Oh no, Jenny from Asian Health, ka pai. And as you can see, the chat is going off, right? Check out the chat there. Everybody's introducing themselves via the chat box. So if we have an opportunity later on, I will make time for more of the staff to introduce yourself. Ka pai? Ka pai? Kia ora. Okay, so tēnā koutou, tā alofa lava, mawalangi e mama. Welcome to the Community Health Services meeting. Well, we have got an agenda, so we're going to get on with that. Kia ora, I just want to make a special mention to those who are joining us from afar. I want to say to those from Waitakere Health Link who have joined us today, thank you very much. And today's program is going to run like this. From 10:10 to about 11, we have got all of our amazing community health services making a presentation. We're going to be starting off with Asthma New Zealand this morning, and we'll be finishing this morning with the Asian Network. So get your listening ears ready, yeah? And from 11 o'clock, we're going to have about 4 general updates. So we're going to hear about the foyer refurbishment. We're going to hear about the open day. We're going to look at the community support brochure, and we're going to hear from the consumer advisory about the consumer advisory vacancy. I think that is Laurel later on. So, and then right at the end of our meeting, we're going to share a locality planning update. Ka pai. So, excellent. Asthma New Zealand. Ka pai. I'm going to read out the organisations, and I'd like you to put your Argentina, welcome back. Whakalofa lahi atu. You can hear, and hopefully we'll check out that we can hear you. Great. So I'm going to read out these organisations. Can you raise your hand, please, using the reaction buttons, just so that you move to the top of the screen, because we want to hear from you, but also we really want to see you. Yeah, we'd love to get a visual on you. So here we go. Long-term conditions, we've got Asthma New Zealand. I think it's Katie. Could you raise your hand? Thank you, Katie. Dementia Auckland, Nicola, I think. Disability Connect, please raise your hand. Denise. Epilepsy New Zealand, I think it's Catherine. Hospice West Auckland, if you could raise your hand to go to the top of the screen. Emmy Auckland, Esther, I think. Muscular Dystrophy, Stella. Neuro Connection Foundation, please. Stroke Foundation, and Your Way, Kia Roha. But I think we have an apology there. So, Kapai, excellent. Katie, are you ready to go, Katie?
I am. Morning.
Kia ora, Katie. No
Kia
mai
ora.
hara mai, welcome. The time is yours.
Cool. Thank you, everybody. And Morena, thanks for having me. My name is Katie. I'm a registered nurse and nurse educator for Asthma New Zealand, and I cover the West Auckland area. Asthma New Zealand is a not-for-profit charity organisation committed to creating a healthier New Zealand where every Kiwi in asthma and COPD, every person with asthma and COPD lives a full life and has a great quality of life. We are New Zealand's largest asthma educator with 10 nurses located in Auckland, Rotorua and Wellington. However, we do endeavour to see everybody across New Zealand if need be. Education, as we know, is the most powerful tool in reducing hospitalisation and improving the way we live with asthma and COPD. And our mission is to see a 50% reduction in asthma and COPD hospitalisation by 2029. So a huge goal, but we're on track to achieve that. We receive referrals from hospitals, health staff, nurses, individuals, their whānau, ideally via our website, which is asthma.org.nz, or by phone or email. Give us a call. We see patients over the course of a year throughout that period. We provide free education, training and support to patients in their whānau with asthma and COPD, bronchiectasis, face-to-face in their home or via Zoom or Teams. We look at what medications they're on, inhalers, spacers, peak flows. We deliver education to high school students and teachers. We go into early childhood teachers, other organisations wanting information. We deliver asthma and COPD education to health professionals throughout the year, several courses there, and we assist doctors and specialists by providing asthma and COPD tailored to suit the needs of their patients. We also do spirometry testing, and we have a shop which stocks brochures, spacers, nebulizers, dust mite protectors and allergy products. So we do sort of a full range. So please have any referrals, send them through to us, and we'd love to sort of meet your patients and support in whatever way we can, working alongside them. Thank you.
Wow, awesome, Katie. Thank you. So much information and a really big goal there, 50% reduction by, by 2025. I mean, a massive mahi. So thank you very much, Katie. Nicola, kia ora, Nicola. Kei a koe te wā. The time is over to you if you'd like to take yourself off mute. And welcome to the staff that have just joined us. I see you joined us in the chat box. Welcome. Kia ora, Nicola. Your time.
Kia ora, everybody. My name is Nicola Brenton. I am a dementia advisor for Dementia Auckland. Lovely to see you all. We are a service that is all across Auckland. I am the advisor for West Auckland. We have 8 advisors. We provide support and information for people living with dementia and their supporters and whānau. So we're available to visit, to talk. We provide support groups. We provide a range of living well activities in the community for people living with dementia, including art groups, walking groups, music groups, cognitive stimulation therapy. Have a look on our website, dementiaauckland.org.nz. If you scroll right down to the very bottom of the homepage, you'll see the referrals. Families can make their own referrals to us. We just need a supporter in that family system to talk with. We also offer really good masterclasses for whānau as well as health professionals. So have a look on our website for that as well. Look forward to getting referrals from you all. Kia ora.
Kia ora, Nicola. Thank you so much. It's great to hear about the self-referrals option too and whānau support. It's really great to hear that and how families and individuals can connect with the service.
Yeah,
Kia ora,
absolutely.
Nicola. Kia ora. Thank you very much. So Denise, do we have Denise? I did see Denise. Kia ora, Denise. Kia ora, Denise.
Kia
Over
ora.
to you.
Thank you.
Disability Connect.
Yes, so we're based in Penrose, but we support families and people with disabilities Auckland-wide. We run support groups. One, we have a Chinese support group and we have a called contract for another support group. We run workshops on education legal issues for families having issues with school or with funding, welfare guardianship for when the young person turns 18. And we have Wednesday seminars where a team from Working Income come and answer questions from families and talk about benefits. Our main job is just providing information to families and connecting them with other organisations that can support them. That's it.
Kia ora. Thank you, Denise from Disability Connect. Yeah. And Denise, please feel free, if you haven't already, to put your contact details in the chat box for others to connect. Thank you. Wow, so we've now got Epilepsy New Zealand, and I think it's Catherine. Kia ora, Catherine. Good morning and welcome.
Kia ora, everyone. My name is Catherine Whiteman. I'm an educator for Epilepsy New Zealand. Epilepsy New Zealand are a national charity who provide support, education and training for people living with epilepsy and seizures. I cover the Waitakere region and I'm replicated throughout the country. So there's somebody in most regions across Aotearoa. My individual role is to work individually with whānau when there's somebody with epilepsy or seizures in the family. I do training and education in schools, kindies, workplaces, support people back into school and workplaces after they've been diagnosed with having seizures. And to raise awareness really in the community, I'll give a plug to our big National Purple Day, which is the end of March, which is the biggest day on our calendar. You hopefully will see purple around your communities. You'll find me in Henderson Mall and in Albany Mall on various dates around that time, working with our volunteers to raise awareness and hopefully to raise some funds as well. Epilepsy New Zealand have a really good website, epilepsy.org.nz, which is fabulous, and it's got lots and lots of good information on there. If you want to make a referral, you can go through the website or you can contact me directly at auckland.nth@epilepsy.org.nz. We take self-referrals as well as referrals from anybody really. People often contact us just because they know somebody who's had a seizure and they want more information, or it might be more detailed than that, you know, somebody who's got someone in their own whānau with epilepsy and they want lots more information. So yeah, anything to do with epilepsy and seizures in the Waitakere region, I'm your person.
Kia ora, Catherine. Wow, we're getting really good at this. We're getting really good at this. Our community services at sharing a lot of information very succinctly. So thank you very much, Catherine. I just noticed that we've had Tipene and Armani join us. No mai korua, no mai. Haere mai. So welcome, and we've had some more staff join us. You know, and that is the nature of this meeting space. You join when you can. If you're on the agenda, please be on time. But, you know, it really is a space for sharing information and, you know, what you're doing and how you're doing it out there, which we really appreciate all of your mahi. So, ka pai, Trish. Morena, Trish, great to see you. Thank you. Your time from Hospice West Auckland.
Morena tātou, ko Trish Fleming aho from Hospice West Auckland. We are your community palliative care service covering the area from the Faux River in the south at the border with Portage Road up to the Kaipara Harbour and right up through the coast and through Greater West Auckland to meet at Albany. We care for anybody aged over 18 who has any physical condition that is life-limiting and requires our assistance and support. So we are a specialist community palliative care team providing 24/7 care with a full complement of medical, nursing, pharmacy, social work, counselling, spiritual care, art therapy, music therapy, rongoa, physio, occupational therapy, etc., social workers that I mentioned them. I'm trying to get everybody in there. Yeah, some of the myths: we don't just care for people with cancer. Our service is open to anybody. Our service is open to people aged over the age of 18. We provide virtual and after hours. We have virtual and after hours care teams also. And we also have a newish service called POI, which is a non-patient facing service and is a consultancy service to clinicians. So we're getting ourselves right round to whātu ora and the PHOs and residential care settings to let people know that there is an MDT consultancy service available to their clinicians. It was neat to meet with Cancer Society nurses yesterday. Our domicile building is in Te Aratū Peninsula. You are welcome to visit Hospice House at any point in time. We provide day programs for patient and whānau on site, including bereavement support. Yeah, I think I might have covered it all, but just look forward to seeing you all out and about. Thanks so much. Bye.
Kia ora, Trish. Tēnā koe, tēnā koe. And yeah, really important, as you say, when we share information, to bust some of those myths out there. Yeah, and give the real information. Ka pai. Kia ora, tēnā koe. So ME Auckland, is Esther here? Kia ora, Esther.
Hi, it's Natalie from ME Auckland. How are you going?
Natalie. Kia ora, Natalie. Thank you.
And my colleague Maddie is here also. She might wave out she's up the top
Maddie,
there.
put your hand up, Maddie, so we can see you too.
Yeah, thank you for having us. This is the first time that we've attended today. I work for ME Auckland, when we're soon to be rebranding to ME Support, and our vision is that we work with people with ME/CFS and long COVID, and we want to help them live their most fulfilling lives. And we're a non-profit or charity, and we don't get any funding from government, so we're all privately funded, so we're always looking for support. But yeah, we work with over 800 members across Auckland and New Zealand, and I'll read you a little blurb about what our vision is. We exist to help people living with ME/CFS and long COVID and related conditions. We provide direct support services in Auckland and now across New Zealand, and online support all across Aotearoa. We help people with ME/CFS and long COVID to improve their symptoms and improve their well-being. This includes related conditions, as I mentioned. Our mission is for every person with ME/CFS, long COVID and related conditions to experience high quality healthcare and community support free from stigma and discrimination. We empower people with ME/CFS and long COVID through solution-focused education, unwavering advocacy, fostering meaningful connections, and compassionate emotional and practical support. We aim to improve the lives of those with ME and long COVID and their families by providing accessible support not otherwise available through the public healthcare system. So we provide a support worker service, also online support groups, face-to-face support groups. We have a whole range of services, and it's free to join ME Auckland, and you can join through our website. So if you've got patients that would like to join, you're most welcome to send them through to our website, and then they can connect through to Maddie and myself. Yeah, and I apologise for the background noise. My house is a construction site at the moment, so I do apologise. Thank you. I think that's about me. Anything to add, Maddie?
Okay. Kia ora kōrua, wonderful to see you here for the first time in this space. Yeah, fantastic update for us all. Interesting to hear, yeah, where you're placed and the services that you're offering. So tēnā kōrua, welcome. Yeah, thank you. Ka pai. Just want to check, because the next kōrero now is, thank you, Natalie and Maddie, is from muscular dystrophy. So I've got down here Stella. Is Stella here? Okay, ka pai. Well, I think this is an opportunity, just well I've noticed, because who we have left in the long-term condition space is, just as a heads up, we have the Neuroconnection Foundation. Kia ora, I see you up there, Ina, Stroke Foundation, and so two more. And then I'd love to call up the staff just again while we've got a few more in the room, if that's okay. So is it Ina from the Neuroconnection Foundation? Kia ora, welcome. If you'd like to come off mute, I'll give the time over to you now. Neuro Connection Foundation. If you'd like to come off mute, and then you can present. Ask to unmute. How's that?
Hi,
There
my
you
name is
go.
Tom Hoey. I'm going to speak if that's okay.
Yeah, yes it is.
So Tom
Pardon
Hoey,
me?
I'm the manager of Neuro Connection. So we're a charitable foundation based in Toohey Glen in West Auckland. We have a purpose-built building there, and we focus on the long-term treatment of adults. We cater for multiple neurological conditions, for example, stroke, Parkinson's, MS, other brain and spinal cord injuries as well. We specialize in conductive education, which focuses on managing disability through the connection between the mind and the body. So really focusing not just on the physical, but on the social and the mental support that's required for rehabilitation from long-term neurological disability. All clients who come to us undergo a physical assessment. We use a group class environment for that purpose, and we also provide sessions in one-on-one for those who are more disabled than others. So it's really an individual service. So it's not a one fits all. That assessment will identify which class and at what level the clients should be treated, and they are put in that respective class. Our aim is to provide people with a better quality of life, just improving their mobility, improving their speech, their overall confidence out when they're out. So we've got about 80 clients, and we do have the skills and the ability to do a lot more. Our building, we own our building, so it is a large building, and we have plenty of room to expand. So my emphasis would be on long term. So this is not a short term, as you know, for people who suffer from stroke and so on. This is a long-term rehabilitation process. So we want to reach out to all of the groups. So really the focus for us is to reach into the community now.
Okay, so Neuro Connection Foundation, that's your time. And what we ended on there was reaching out. Yeah, so connect, reaching out to other organizations. So please use this opportunity, this forum, to connect with each other. Yeah, use the chat box. You can message each other, all of those tools that we have available to us in this space. Kia ora, we have one more, I think, and I think someone from the Stroke Foundation is here. Could you raise your hand if you actually are here? We've got Monica actually down as one of the contacts. Oh, there you go. Kia ora, would you like to come off mute? And then the time is over to you.
Oh, kia ora. Kia ora tātou, ko Pauline Mitchell-Aho. The Stroke Foundation of New Zealand is an organisation dedicated to the prevention of the recovery of stroke. The Stroke Foundation employs community stroke advisors, which I'm one, and return to work advisors. They offer a vital range of free services throughout New Zealand. These services range from home visits, rehabilitation advice, workplace advocacy, and referrals to stroke professionals all over Aotearoa. And the aim is to help stroke survivors recover. The Stroke Foundation employs a team of health promoters. They travel the country and work to prevent strokes by educating the public about recognising early signs of a stroke and administering free blood pressure checks in the community with our blood pressure vans. The Stroke Foundation is closely affiliated to stroke clubs across Aotearoa, which run regular networking support groups and exercise classes, while also offering social activities and events to all its members. Our vision, a New Zealand where significant steps are taken to reduce the number of strokes. Everyone understands and responds to key risk factors, and that everyone affected by stroke is supported and empowered. Our mission is to prevent stroke, improve outcomes, and save lives. Tēnā rawa atakoe. Thank you so much. Kia ora.
Kia ora, Pauline, well done. Tēnā koe. Thank you. Thank you very much for the update from Stroke Foundation of New Zealand. Ka pai, there's a lot of kōrero, right? There's a lot of information coming at you. And there's a lot of information to be shared. Just before we go on to the maternity and child health sector, I really like to invite our staff, our Whatuora staff, our staff who are here today to please raise their hand, raise your virtual hand. And what that does, if you go to your reaction button, you can see a raise hand option. It's a long option. It's not an emoji. Thank you, Lynn. Thank you. Thank you, Sulu and Ainsley. Thank you so much. Welcome. Hi, Mai. Thank you, Marion, Katrina. Trace, kia ora, kia ora. So welcome. It is really important. And we really appreciate you making the time to come and join us in this space. This space where we get to share information on our NGO services that are out there. And so thank you very much in your busy schedules. Viola, welcome. Thank you very much for being here. I'd like to put a question out, just one question, to one of the staff. And just before we're then going to move on to the maternity and child health sector and their presentations. But I wonder, Sulu and Ainsley, looking beautiful over there with your tapa, with your fala there in the background. I just wonder if, you know, we'd love to hear from your perspective about what you come here to hear about. What is important for you to hear from in this space? Is that okay if we just ask that question? I'm checking with Tracy to see if she's winking at me. Yes. Yep. Yes, she's saying that's okay. So Sulu and Ainsley, is it okay if or you come off the mute and respectfully you could pass it on to a colleague if you don't want to, but really love to hear what is useful for you from a staff perspective to hear about in this forum. What are the things you are listening for?
Sulu, I'd just like to give the opportunity first to my seniors.
Thank
Sulu
you.
or Viola, then I can say a little spiel.
Thank you very much. Viola, yeah, thank you. They respectfully have passed on the opportunity to their senior. So welcome. Tēnā koe, nau mai, hara mai, whio mai. Welcome. Yeah, so we'd love to give some time to you just to maybe introduce yourself and talk about maybe what is the value or what are you listening out for in these spaces?
First of all, I just wanted to say thank you very much, Henimo, for allowing us to have a time in this forum. I saw that our directors here, Josephine Aumea Herman. So Aumea, are you here? And I think, just looking at the time, and I know that there's a very limited time in this forum, but for our service, we are the Pacific service that sits under the Whatuora, and we look after the Waitemata district. So the Pacific service sits under the specialized services in the hospital. We have a small Pacific team, and we have navigators, and the purpose of the service is to provide cultural and pastoral support for all Pacific families that come to the hospital. I think the purpose of coming to this forum, we have a lot of our families who been discharged to the hospital and from the hospital, and wanted to support them when they go out, because the service that we provide is just inpatient. So this is I just wanted to acknowledge the work that the Pacific, the link, the Waitamata link, and connection to our communities and our families. And I think the purpose of the day is to see who we can refer our families to, and the services that's in the house, in the community, and acknowledge all the work that that's been done and all the services outside. I think that's just that from me and my team. Sulu is our clinical nurse director, Pacific, in the team, and Dr. Josephina Herman is our director, and Ansley here is one of our lead and our Pacific navigators. So malo apito, hine more for the opportunity.
Oh, malo. Thank you so much, Viola. And, you know, having your team here and to hear that it's about the ongoing care and well-being of our families and connecting services that can support them after their experience there. So thank you so much for making the time. And it's really important that we stay connected. So thank you. Much gratitude. Awesome. So I heard that muscular dystrophy is actually joined us now. Oh, sorry, Tracy.
Yeah, I was just going to say that.
Oh, were you? Okay, kapai. Thank you. So just to let you know, Tracy is running things in the background. So we do know that muscular dystrophy has showed up now. So would you like to raise your hand, or is it, I have got Stella. Is it Stella or is it someone else here? Lynn, looks like it's Lynn waving. Kia ora, Lynn. Okay, so you've got your time now, 1.5 minutes. Thank you.
So kia ora, everyone. Good morning. I'm Lynn from Muscular Dystrophy. Sorry for being late. I had issues with the internet. I am a field worker for muscular dystrophy, and in my role as a field worker, I do advocacy, education, and support for families, newly diagnosed members of family, or people who've lived with some form of muscular dystrophy for many years. The organisation itself is quite long-standing. We produce a quarterly magazine, In Touch, just to keep everybody in the loop. We have information sheets. We attend clinics. I go to Starship Clinic, Auckland Hospital Neuromuscular Clinic, and Whangarei Hospital, to the clinics there. So we also promote the neuromuscular registry, trying to get people to join up with regard to, they'll hear about overseas trials, new medications, and lots of information and things like that. We put clients forward for trials of medication via Pharmac. So if there's people who may be suitable for a new Pharmac trial or for an overseas trial, we will put their name forward and see if they can be accepted. We do home visits, and we do a lot of work around grant applications. So if a person needs lotto funding, say for a new vehicle or something like that, we will help and assist with them putting together that application to be sent out to Lotto. Work closely with organisations like Mobility Solutions, especially around power chairs and equipment and things like that. And we sometimes, not me, but the organisation will do submissions to Pharmac with regard to medications that they're looking at bringing in for people, new medications or discontinuing other medications. And we also run camps for adults and kids down at Ngarawahia. Anybody's welcome, anyone can go along, and they're really, really popular.
Okay, we've lost Tanimoa, I think.
I'm back.
Oh, yay.
See, we're all getting tested in the muting area today. So kapai, thank you, Lynn. We both got muted. So please share your details in the chat box. Great to hear about those camps that happen in Ngarawahia for our rangatahi, our young people. So awesome. We're going to move on now to the maternity and child health sector. And so I think I have actually got parent aid. Have we got parent aid? I'm going to ask you, Gormeta, thank you. If you'd like to put your hands up, these people. Mental health. Sorry. So here we go. We've got parent aid, Cancer Society, Family Action. I saw Michelle here already. Family Action, Man Alive, Problem Gambling Foundation, Te Ata, Whakatautua, and Walsh Trust. Kia ora koutou. Ai, hapai. So, te wātuatahi, firstly, we're going to hear from Parent Aid. Parent Aid. And who's here from Parent Aid today? Hapai, if you'd like to come off mute, Gormeta. Kia ora. The time is yours.
Kia ora koutou. Thank you for this opportunity. Waitakere Health League. My name is Gormeta Prasad and I'm the manager at Waitakere. We offer short-term respite support to parents and caregivers of children aged 0 to 14 years old in West Auckland, Central and North Shore suburbs. We provide a free in-home childcare and helping service for parents and caregivers in times of illness, accident, stress or other emergency to ensure that the young are safe and free from harm and neglect. We provide practical support, parental coaching, as well as companionship and linking with other specific care services for those parents who often are socially isolated from family and friends. By offering temporary respite access to parents and caregivers, we alleviate distress and channel that into positive and empowered parenting. Anyone can make a referral for this service through our website. Upon receiving referrals, we contact the parent caregiver and make an assessment before allocating field worker support visits. At the moment, we're about 6 weeks behind on the new referrals we received while we were closed for year 2022. And after opening this year, our service was also affected by the recent Auckland weather event. We have recently introduced another service, Pathways to Employment. This is for our parent communities and they do not need to be clients. They do not need to be our clients to receive this service. This is a one-to-one support program. We support parents by assessing their needs and planning employment, education, training, and career goals. We assist with CV and cover letter writing and providing and linking with other relevant services in the community. Referrals for this service can be made through our email and contact details also available on our website. Thank you.
Well, thank you. Gormeta, you've had lots of practice at this, hey, by now. So thank you very much for your presentation. And just a reminder to everybody that as part of your presentation, we are recording it so that we can share it, so that we can hold it and put it on the website so that when others are looking for services, they can go there and click on your organisation and hear from you, from the organisation. So just a reminder that you are being recorded as you present. So ka pai, tēnā koutou. We've got the Cancer Society now, and we've got tēnā koe tīpene nau mai whakatau mai rā, talking about the Kia ora e te iwi program. And so we've got a bit longer here because I think this might be a duet. It might be a combination of information and kōrero. So just so that you know, we've got a little bit longer here. That's right, isn't it, Tracy? So we're allowing up to 5 minutes here for this kōrero so that we can get all of the information together as it fits naturally. So tēnā koe tīpene, kaya koe te wā, the time is over to you and your team.
Kia ora, tēnā koe hene moa, ngā mihi o te wā ki a koe, o te rā ki a tātou katoa. I'd just like to hand it over, I'd just like to hand it over to Fiona, my colleague who works in West Auckland. She can begin our presentation and then I'll jump in from there. Ngā mihi.
Kia ora whanau, ko Fiona Sa, taka ingoa. I am the support nurse specialist out here in Northwest. So I cover, I'm one of 4 nurses that cover out this way, but my predominant area is Massey, Bethells, Middlewai, up to Purungaremu and Herald Island, Albany. And so I'm working in partnership with Tiffany, who is going to tell you about the awesome program that the Cancer Society is about to bring this way. So kia ora, Tiffany.
Kia ora tātou, nei rā te mihi kia tātou katoa e hara mai nei, te whakaputa wā koutou kōrero, e haka marama mai kia mātou hea wā koutou mahi, me pēhia nei te whakawhanaungatanga tātou kia tātou, nā reira, e mihi ana kia tātou. Kia ora everybody, my name is Tipene. I hail from the Hokianga on my nan's side and Te Aurere on my grandfather's side. I currently work for the Cancer Society in New Zealand. And my position is Kai Arahi Matua, Kia ora e te iwi. Now, Kia ora e te iwi, there's two meanings behind the name. One is the health and well-being of the people, kia ora te iwi, so ora being health and well-being. And the second part actually is Kia ora e te iwi, as in hello to the people. And the reason behind that is the Cancer Society has acknowledged that it hasn't done a lot in terms of support and awhi for Māori over the last 90 years. And there's a real acknowledgement there. The Cancer Society has created an equity charter, has put Te Tiriti o Waitangi at the centre of everything we do now. We've got professional development, we've got Māori on the board, and we've got a higher uptake of Māori staff. And so what we're trying to do is provide a safe space for Māori to come and get support, seek treatment. And this isn't just for patients, it's for their whānau as well. Now, Kia ora e te iwi is a one-day workshop where we deliver kōrero around what is cancer. We talk about the services that the Cancer Society provides. We also talk about the supports in the communities that are available. And we also give whānau information on how to access all those supports. Now, the kōrero, as I understand it, is over the next 20 years for Māori. Everyone's impacted by cancer. I don't want to take away from that. But in terms of Māori cancer rates, we're looking at 50% of all Māori will either have it or someone in their immediate family will have it. And unfortunately, the current rates for Māori cancer palliative care is quite high. Māori are seeking palliative care over treatment. And quite simply, it's because we don't know where the services are and we don't know how to access them. But this program, whānau, is for all patients of cancer, their whānau, their carers, their supporters. Our target audience is Māori, obviously, but at the end of the day, we're looking to service all New Zealanders. But yeah, the main goal and outcome of this program is to get more Māori under the Cancer Society umbrella, seeking and receiving the support that's available. It's all free. So if you do know whānau, even yourself personally, you have whānau that are impacted by cancer and you want to know more, and you'd like to do that in a community way where we share the information either at your marae, we can come to your hauora, we can come to a community building and deliver our program. So I've put my email into the chat box, and you can contact me directly. And I cover Manukau all the way up to Te Kao. So really looking forward to hearing from you if cancer is something that has impacted you or your whānau or the people that you work with. Hoi no rā, e mihi ana kia tātou katoa. Whai whakaaro waki ana kia rātou e tū ana I runga e te atamira o te matatini. Tēnā rau atu kia rātou. Hoi no, tēnā koutou katoa. Kia ora. Thank you. Ngā mihi.
Ai, ngā mihi mahana ki a koe, ki a pōrua hoki. Fantastic to hear about the Kia ora e te iwi program, Tipene and Fiona. And one, well, that's a big area, my manukau ki te kao. So, you know, and also awesome to hear that the service can go out to marae and whānau and community settings. So, ai, tēnā kōrua.
Ora, tēnā koe.
Yeah, aye, kia ora. So, and yep, really acknowledging those teams that are standing out there at Mount Eden today for Te Matatini. There was just an acknowledgement in there to raise spirits and probably funds much needed for our community. So tēnā koutou, knowing that there are other things and other ways of well-being happening out there in our world. Kia ora koutou. So we are up to now, Michelle, kia ora Michelle from Family Action.
Kia ora. Oh, sorry.
Nice to see you, Michelle.
Kia ora, just trying to get my video to work. Kia ora tātou. Thank you for the opportunity to be here today, and lovely to hear everybody and see and find out what you're up to. So kia ora, I'm Michelle Clayton. I'm Chief Executive of Family Action. We do services for adults, but we also do services for children, and I'm just aware that we're talking about in the children's part today, so I'm going to focus on that. So for children, we offer quite a few services. We are predominantly a family violence and sexual violence trauma agency. So I'm going to say the word sadly, but it's also good. Sadly, we offer services for children who've been sexually abused or assaulted. We've got experienced counsellors and social workers who provide 24-hour service to them. So they will go and do medicals, they'll escort and assist through police procedures, they will support their families. Also making sure that their wider needs are met and making sure they've got what they need for school and adequate access to food and safety and all those kind of things. From a family violence perspective, we also offer counselling and support for young people who've witnessed family violence. Our new project is we've now employed a rangatahi social worker that's specifically to work with the police and the MDCAT table, which is a multidisciplinary table that tries to look at more intensive ways of supporting our rangatahi that are getting into trouble during the ram raids, stealing cars, all those kind of things. So that's quite a new project for us that we're quite pleased to be involved with. But yeah, it's everything we do is with a little bit of sadness, because obviously it means that our community is not thriving in the way we would hope. But we are hopeful that we make a difference and we'll make some real change for that. Sorry. As well as the family violence and sexual violence services, we offer programs for young people. Some of that is around building self-esteem, dealing with anxiety, looking at relationship issues, but also when they're having problems in schools. Obviously, as well. Hinamo, you keep muting me. Never mind. But I think that's...
Yeah, you definitely got muted on the last one, Michelle. Kia ora. I thought it might have been a glitch, but yeah, thank you, Michelle.
No worries.
And the update that you have, especially around the work that you are doing at this time with rangatahi, with our young people. So thank you very much, Michelle, from Family Action. Kia ora. Man alive, is Jose here?
Kia ora, everybody. My name is Jonathan.
Kia ora, Jonathan.
I'll be filling in for Jose this morning. So yeah, thank you for the time. I'm okay to get started?
Absolutely, Jonathan.
Okay.
Time is yours.
Thank you. So just, my name's Jonathan from Man Alive. I work for the youth department here. So that's specifically 8 to 24. And we have a range of programs to suit youth in Auckland, but specifically West Auckland. We're based in Henderson. So the programs we have here are Boys Alive, which runs every term for 8 weeks. That's specifically to do with anger management, to support young people with that. That's from 4 till 6:30 in the evenings. And we also involve the whānau with that. We have another program, Growing Men, which is individual sessions specifically for anger management. So that's a precursor to the group work that we do with boys. And then we have a youth general counselling group, which is every other issue. So that includes depression, anxiety, bullying, sexual abuse, issues around drugs or alcohol, parent separation, sexual identity, and grief. The other program we offer is Boys Alive in Schools, and that's specifically or a transition program from years 8 to 9. So that's from intermediate into high school, supporting the young boys in that transition at their school and then at their new school. So yeah, please get in touch with us either via the web or email or whatever suits you, or give us a call. So yeah, thank you very much everyone for your time.
Yeah, kia ora. Thank you, Jonathan. Wow, working with our rangatahi from the age of 8 years old. And so, yeah, if you know any, thinking about our tāne, our boys, our men, and how important it is for them to stay connected and have services. So if you know anybody, Jonathan's here. So contact him in all the ways that he is given, that he has shared to do that. Kia ora, Jonathan. Thank you very much. Okay, so we have got, is it Problem Gambling Foundation? Who have we got here today, Shayal?
Kia ora. Yes, that's correct.
Oh, it's important, eh? Names are important. So kia ora, Shayal, welcome.
Kia ora, thank you. Kia ora, everyone. My name is Shayal and I'm a Pohiwa health promoter with PGF Services. And I just wanted to talk a little bit about our gambling spending across New Zealand. So every year more than $2 billion is being spent on the 4 main types of gambling. So you might be like, what are the 4 main types of gambling here in New Zealand? So this money that I'm talking about is coming from, you know, money being spent at TAB, New Zealand lotteries, gaming machines outside casinos, and casinos. So this total here doesn't even include any money being spent on online gambling, which we all know is starting to become quite popular here in New Zealand. At PGF Services, we're here to provide free, confidential and professional support to anyone that's being impacted by gambling harm. That means support is available for gamblers as well as their friends, whānau and colleagues. And we also work to ensure that our support for Māori clients is culturally appropriate and mana enhancing. The public health team, which I belong to, is responsible for connecting with communities to raise awareness of gambling harm and support community well-being. So I can come out to you, to your office, and we can look at ways of educating you, your team, your staff, any volunteers that you have on board in regards to talking about gambling harm confidently, identifying and screening for gambling harm. I can also provide any guidance for organizations around creating policies on safer gambling environments or gambling harms within the organization. Also, I've left my contact details in the chat. If you'd like any fact sheets, briefings, any research information, or just other resources related to gambling harm, please feel free to reach out as I can provide that to you as well.
Whawhetai lava, Shayal. Whoa, hearing some really sobering facts and information this morning on this community Zoom meeting. So thank you very much, Shayal, for sharing that and your details in the chat box of how people can connect with you. So in this area now we've got Te Ata, Wakatautua and the Walsh Trust to hear from. I can also see that Argentina, you are there from Takiwa or Tamaki, I think, or your hand is raised. So after those ones, we'll have you in our kōrero. So thank you very much. Have we got Te Ata? Is that you, Tracy? Kia ora, Tracy.
Kia ora.
Nā koe.
I was, okay, awesome. Morena all, called Tracy Cannon Aho. So I'm the brand new coordinator at Te Ata. It's been 3-4 weeks, and you know what the last 4 weeks have been like. So this has been, an interesting time to start a new role. So Te Ata is a peer-led and run support, recreation and education centre for people who've experienced mental health challenges. So we're a joint venture between Te Whatu Ora, Waitamata, we get some funding from Waitamata, other DHB, and the West Auckland Mental Health Support Trust, which operates as an independent charitable trust. So we've been operating for 20 years. So it's a very long-standing service in the community. Our staff, tutors and volunteers, along with 2/3 of the board, have their own experience of mental distress and recovery in the many different ways that we understand that. The name Te Ata was gifted by Peramia Porter, who was a kaumātua at Waitamata DHB at about 20 odd years ago, and he's since passed on. So the name means he took it to mean the pathway, but it can also mean the glimmer of hope. The glimmer of hope at the rise of the setting sun. So that little glimmer that you see just before the sun rises, which I really like, because to me that's the hope of another day, which, yeah, if people who have whānau or personal experience of mental health challenges understand that hope can be very important.
Oh, Tracy, kapai, minute 30 goes fast, huh? So, yeah, I know there's so much more to share, but first of all, congratulations, Tracy, on your new position at Te Ata. It is indeed a challenging time, is what I would say for me. So thank you for sharing. The chat box is there to continue to share, you know, about what you do in the recreation space around the mental health services. So kia ora, Tracy. Thank you very much. And whakatau tua, I made a mistake, and Argentina, you are from whakatau tua. So welcome. Thank you very much. Great to have you here and looking forward to your kōrero.
Thank you.
The time is yours.
Thank you, Hine. Kia ora ana, whakalawhai to everyone. Kua ko Argentina Whatialofa. I'm the team leader here for Whakatau Tua, Waitakere and Mount Albert now merged. And we're operating from the old Wounds building here in Mount Albert. We've got a head office in Manukau counties. We've got branches in Wellington, Christchurch, Canterbury, and Otago. I'm going to share the services under Whakatau Tua because it's going to take a little bit more time. But my purpose of being here today is just to let you all know, you know, with the aftermath of the flood, the anxiety level, the loneliness, all of the mental health issues are out there, and it's huge. And our main campaigning at the moment is to follow up. We're doing a major follow up on our Pacific families on what can we do to help them. How to access the civil defence payment, how to follow up on the housing application, WINS application, their entitlement, why they're not getting any grant. So those are the major things that we wanted to follow up. And we wanted to, any Pacific family who needs our extra support, we're there. And it's really to help them lessen the level of anxiety, strengthen the resilience to be able to continue and to be able to find ways to be able to maintain their mental and health well-being. But
thank you very much, Argentina. So important to hear also what you are doing in this space with what people are facing right now, right? What's right in front of them. So, whawhetai lava, thank you so much for your work that you do out there in Whakatau Tua. And please connect with Argentina in the chat if that is going to be helpful, if you know families already. So we're running, I'm just checking in with Tracy, we're running about a little bit behind, about 10 minutes. So I'm going to continue as I call up, Welsh Trust, Rob. Rob, are you here, Rob, from the Welsh Trust, or anybody here from the Welsh Trust?
I can't see anybody, and I don't think comprehensive care is here either.
Okay, great. So shall we move on, Tracy?
Yeah.
To Amani, kei konei a Amani, I think. Amani is here. I think I saw a mihi from Amani in the chat box before, from Ngā Takiwa o Tāmaki Trust. Ngā Takiwa o Tāmaki Trust. If you could just raise your hand, please, Amani, and come to the top of the screen. Then we've got St. John's. I think it's Eleni. Te whānau Waitakere, apology today. And then we've got Sam here from the Asian Network. Kia ora, Sam. And then
Ka aroha hine moa ko Jolie tēnei no te whānau Waipareira.
Oh, tēnā koe, Jolie. Kia ora. Raise your hand, Jolie, and you'll come up to the top so that we can see you when you get your opportunity to share. Kia ora, kia ora. Thank you for being here. Tēnā koe, Amani, kei a koe te wā. The time is yours.
Ngā mihi mahana nui ki a koutou, ngā mihi ki te tūtaki ki a koutou I tēnei hui topa. Lovely to meet you all, ko Amani Houghton ahau no Pāmapuria te pātū me Ngāti Hine ahau. I'm the Executive Administration for Ngā Takiwa o Tāmaki. We are Ngāpuhi's representative here in Tāmaki, just offering support to whānau Ngāpuhi, but broadly Māori in general. Kia ora.
Tēnā koe. Ka mutu koe. Ka mutu te kōrero. Ka pai. Tēnā koe. Nau mai hara mai ki rānui. He maha ngā tangata Māori kei reira. Yeah. So I'm just recognising tō whakapapa, ngā mihi nui kia koutou, ngā te iwi o ngā puhi, ngā whānau, ngā hapu o Pāmupuria, ka huki ngā mahara kia rātou. Tēnā koe. Kia ora, Mani. Nice to meet you. Great to have you here in the space.
Nice to meet you too.
Ka pai. And where are you based? Can I just ask a question? I didn't quite.
At the moment, we're based in at Te Piringatahi o Te Maungarongo Marae at
Massey?
West Harbour, Luckens Road. So that's where our headquarters are at the moment.
Ka pai. Thank you. Tēnā rawa te koe. Ka pai. So Ngā Takiwa o Tāmaki Trust, and then we've got Eleni, or is it Sally? Kia ora, Sally from St. John's.
Hi, can everybody hear me?
Yep, we can hear you. We can't see you, but we can hear you.
No, I know. Sorry, I picked up a brand new laptop yesterday, so it's not cooperating, but that's okay. At least you can hear me. Thank you for having me. I'll keep it brief. Some of you may know me. My name's Sally Johnson from St. John in the medical alarm section. So I've put my details in the chat, and my role really is to provide information, education and support for health professionals and those people who are referring people for medical alarms for their support in the community. So pretty much I provide education sessions to teams. So there's a number of teams that are on here that I probably haven't seen. We've got a number of resources and PDFs around St. John services. So it's a range of services, including the medical alarms, and we've got things like other language brochures. So or 13 other languages. So it's just give me a call, send me an email, and I can organise to come and see you either one-on-one or in a group setting and provide that information for you. That's it. There you go.
Oh, sharp, Sally. Kia ora. Thank you very much. So give you a call or email you. Ka pai. Thank you very much. Tēnā koe. Kia ora, Jolie. Nau mai, hara mai, te whānau o Waipareira, kei roto I te whare, kei a koe te wā.
Tēnā koutou I te iwi. Ko wai au, ko Jolie Thompson taku ingoa, he uri tēnei no Ngāti Pukenga, Ngāti Whātua me te whānau Waipareira hoki. My name is Jolie Thompson. I'm one of the 4 frontline management leads for Kōrere Whānau, which is the service delivery of Te Whānau Waipareira. We have a cohort of more than 100 frontline kaimahi or whānau professionals. Just a little bit of background, Waitakere was established more than 40 years ago in Henderson, West Auckland, to provide a service that feels like whānau to counteract the impacts of urban migration, and in turn provide equitable access for whānau across health, social justice, employment, education, te mea. We provide a whānau water service, which acknowledges that for the whānau that we serve, that these different aspects are all interconnected. We operate our own on-site ecosystem, so we have everything on site from our own systems and computer developers, right through to our own data, network and performance. We have our own finance team. We have our own. We are our own ecosystem. On the front line, we provide an integrated health program, which is designed to wrap around whānau to meet their individual needs. Our services are entrenched in kaupapa Māori wellness methodologies, and they range from mental wellness support or mental health support, previously known as, AOD counselling, parenting support, housing advocacy, financial support and budgeting support, access to family harm, education and support to enrol tamariki and our tamariki mokopuna into kohanga reo, ECE, and any other activities that whānau find beneficial to help them achieve their own self-determined aspirations.
Auwe, kua pau te wā, aroha mai e Jolie. Yeah, there is ngā mihi nunui kia koutou ngā kaimahi o te whānau Waitakere, tō manaaki, tō awhi, kia mātou o te hāpuri. So just really acknowledging the many things you do that there is no way you could talk about in 1 minute, 30 seconds. Totally understand that. So tēnā koe, it's really valuable to have you in our space. Tēnā koe. Okay, ka pai te whānau Waitakere, and then kei konea Sam. Is Sam here? Sam from the Asian Network, or one of the team from the Asian Network?
So Sam, we clashed our meetings times with the Asian Network, and he sent some PDFs to share, which Benjamin's going to do in a minute. But meanwhile, we've got Matthew Stewart, who's an osteo, who might want to have a, oh, I know, we've got that. We could have him next after this Asian Network information. So they're talking about their newsletter. If you've got anything to go in their newsletter, then contact them. And next slide, Ben. And they've got some migrant wellbeing programs coming up. If anyone's interested in those, I'll put the coordinator's phone numbers at the bottom. They've also got lots of other healthy lifestyle things, driving lessons and English confidence classes. And there was one more screen. Emergency support. So there's lots everyone's doing at the moment. I'll hand back to Hinimawa.
Ka pai. You hand back to me. And thank you, Tracy. Thank you for sharing that info. And you can also take screenshots, hey, if there's something that you really see that you need to capture, that's useful. So Tracy, can I just check in with you about the staff member?
Okay, so I'm still waiting for Paula, who is...
I'm here.
Paula's here. Yeah, and was there someone else that you thought might want to share?
Erica's...
I'm here. Yep, I'm here. Hold on, my video's a bit not working. Hold on.
Kia ora, Erica. Welcome.
Thank you.
So Tracy had a great idea.
So we could move on to the updates, which Paul is here to update, and Erica on her community support brochure.
Okay, great. So yeah, thank you, Tracy. Thank you for sharing the update from the Asian Network. We're now onto our general updates, and as part of this, we're going to hear about the hospital foyer refurbishment. We're going to have a kōrero about the open day, look at the community support brochure, and then end the general updates hearing from Laurel about an opportunity for the Consumer Advisory Panel. So, ka pai, welcome, Paula.
Kia ora koutou, lovely to be
Paula,
here. Oh.
Can I just ask you to raise your virtual hand, and what that will do is put you at the top of the screen so that we get a great view of you.
Oh.
In your reactions, there should be a long bar at the bottom that says raise your hand.
More reaction.
Perfect. Thank you, Paula.
Okay, shall I lower it now or?
It'll just stay there.
Okay, we'll keep it on. Kia ora koutou, lovely to be here and to see you all. Thought I'd just start with what's happening and the impact from the floods that we've had and Cyclone Gabrielle. So for those of you who know the Waitakere campus well, you'll know just as you're coming in the main entrance, there's some buildings on the right. That's the Snellgar building, and when we have our simulator centre. So the Snellgar building was, the basement was flooded, and it has impacted a distribution board, which is currently we've got free parking, but it won't last for long. Impacts the barrier arm. So I hope that comes online soon. It's also meant we've had to decanter a building's worth of people into other areas, and it has taken us away from the foyer refurbishment. So that just so you get the picture as to it's still on the cards, but we have had some delays in that. Key personnel who have been put into other areas. So the foyer refurbishment, it's kind of in a detailed design phase, and our next stage will be looking at construction when we have the personnel back from being deployed into other areas to be able to do that. So I personally work in the Snellgar building, and it has just been situated behind the main reception desk in the main office as a decanted location for me. So I can definitely see it's very, I think we all know it's much needed across the hospital to give us all some life and some planning across the hospital services, and also how the next stage will be how we work in with NGOs to be able to have some space in there. And I've got some key ideas having spent a bit more time in that area. So there's that piece of work. We're really waiting for visitor restrictions to change as part of the overall COVID response to be able to hold open days and the market day back in the foyer. So now that we're under one health organisation, all decision making is generally regional if not national. So those decisions can take a little bit longer, but it means there's consistency across the region, which is, as many people will know, it's a whole lot easier if we have that consistency. So I will be planning for later in the day. It will be wonderful to see people in person again and to have this on site. But we're not there just yet. We are noticing a few more cases of COVID coming in, and we've had our first case of measles in Aotearoa, New Zealand. So we do hope that doesn't continue to increase. And here's the plug for please make sure, particularly those older adolescents into their 20s, I think it's about 16 to 32 now, that age group that gets the MMR vaccine. Sorry, that's a wee plug there. Tracy didn't know I was doing. But yes, we have managed to open some of the buildings that were closed due to the floods this week, but just got that one left. I think that's the main updates. So many of you will know there is a master plan for the Waitakere site, and we will, there's been a lot of design work done on a new 30-bed medical ward and ICU. So I would expect that construction to start sort of mid next year. And that will be the start of some of our planning. We're also will be progressing with a business case for Child, Women and Family Centre of Excellence, obviously a bit close to my heart, as that's another part of my role. So those are the key updates. Has meant that some of the buildings are looking a bit tired because they will be demolished in this master plan, but we're trying to make the best of it. So I think that's all from me, unless anyone has any questions.
Kia ora, Paula. Thank you so much for the update. First of all, on the foyer refurbishment, and then also, you know, where we are at in terms of having another open day on site at the hospital. So thank you for that. Are there any questions? And I'm going to refer to Tracy in this space. Anything else, Tracy?
No.
Paula.
Move on to Erica, who's going to talk about Croatia, which is very exciting.
Yeah.
Thank you, Tracy, and thank you for inviting me to talk about my community leaflets, where most of your organizations will be put in or already put in. Just trying to share it with you. There we go. So I'm from patient experience, and I've worked for an NGO myself as well. So I know how great you all are, and I'm just trying to make the connection better between the healthcare professionals and the patients and us as NGOs. So what I've tried to do is make it as a guideline. So there will be a lot of people in there that are you guys or you know of. What I've done is I spoke with about 48 patients, so I've had their input in there, as well as talked to some health professionals and been in contact with some of the NGOs. So I'll share it really briefly, but what I actually would like to do is you emailing me if you would like to see the draft of the leaflet and see if you're happy with the spiel that's in there. So it's a very brief one, because it's obviously a lot of organizations in there, and it's the north and west, so it's the Waitamata catchment area. So I've got this as I hope you can see it actually, and obviously it's a draft, so it doesn't look as tidy yet. But this is the content. So we've got general health services, post-injury, community services, hospice support, disability, mental health, social services, maternity, child, women and health, youth, rainbow support, men's health, older adults, connecting families, cancer services, long-term conditions, cultural support, and finance and legal advice. So that's it in a nutshell. I'm not sure if it's helpful to go through who's in there. I think it's better if I just send it to every one of you if you're interested to see if you're in there, and if you're in there, if you're happy with what's in there. The plan is to give it to charge nurses as well as clinics, and hopefully this gets to the patient that way. I don't know if there are any questions.
Are there any questions? Thank you. Thank you, Erica. Are there any questions? If you'd just like to come off mute. Trish Fleming from Hospice is saying, yes, please send it.
Yeah, actually my email address is in the chat. So it's Erica Fairbank from Patient Experience. And you can find my email somewhere on the top of the chat. So please flick me an email and we'll communicate after this meeting.
Erica, could you send it to Tracy to send out via the distribution list? Would that?
Yes, sure.
Cool, thanks.
Yeah. Thank you.
Fantastic. Thank you, Erica. Any other
No worries.
questions? We've got a couple of minutes. We're actually running a little bit ahead of time now. So I can't see everybody, but please, if you do have a question, just come off mute. You're going to get some feedback anyway by the sounds of it.
Excellent. Thank you.
So,
Thank you. And thanks for inviting me to share this.
You're welcome.
Hinimo, could I just ask a question, Catherine from Epilepsy New Zealand? It's just around the practicalities. Catherine. Will Erica have a list of all our email addresses to send, or do we need to say we'd like to see it?
My understanding, just from our conversation now, is that Trish asked if Erica can send the copy to Tracy for distribution to our group here.
Fabulous, fabulous. That's great. Thank you.
Okay. Thank you.
Hi, Erica. Just wondered if you'd had any feedback on having a separate peer support section, not just for mental health, but for broader health as well. Just wondered.
Yes and no. So depending on the topics, so some topics came up that people wanted to chat with others, and some will be in there as well. I've had better parents and in there as well as grandfriends. So that one's been very popular, where you have young families, for example, or single moms that would like to be connected with a family, and they have the time, they're retired quite often. I've noticed that's one's quite popular, so that's a sort of a connection, a peer support. But if you know of someone else or another organization, I would really like to know.
All right, thank you.
The other thing I would like to share is when I actually spoke with the patients and I came with the draft of the leaflet, almost everyone wanted it. So it's been quite interesting to find out how many people out there need support in whatever way possible. So yeah.
Can I just say, Erica, to the others, when Tracy and Erica and I were going through it a few days ago, I noticed that most of the things in there are actually peer support that comes in with a lot of the things that they do. And yeah, I mean, you know, it's a great piece of work, it really is. But most of the groups do already provide peer support.
That's so awesome, and it's so awesome that it's a printed, you know, that it's a printed leaflet. Yeah, in my experience, being able to having something available in the community that people can just pick up as and hold on to for when they might want it is so great. So thank you so much for that. It's wonderful.
Kia ora, some great feedback there. Thank you, Erica. I think we've got one more question. We've got time for one more question. I think it's from Stroke Foundation.
Yes, I just wondered, you mentioned you were passing out the pamphlets to the nurses. Are you also going to send them to the doctors?
Yes, I'm planning to do a bit of a campaign once it's done. So I'm in this sort of finalizing phase. And obviously I need to tidy it up a bit too, but I'm definitely going to go past a lot of health professionals. And this is not a one-off, I'm going to do it repeatedly. But thank you for your question.
Okay, awesome. Awesome feedback. And yeah, thank you, Erica. Thank you. Thank you very much. So I think Laurel is here. Laurel has arrived. I thought hallelujah. Thank you, Laurel. Thank you, Laurel. Laurel, would you like to just raise your virtual hand using the reaction, so that what that will mean is that you will come to the top of the screen and we can see you easily. Thank you so much, Laurel. We know it's a really busy time at the moment, so we appreciate the time that you've made to come and speak to the meeting about the consumer advisory opportunity. So I'd like to hand over the time to you now. Thank you, Laurel.
Thank you very much. And I'm sorry I was late. Yes, coming from somewhere else. And I'm sorry that if you can't see me terribly well, we haven't got any curtains at the moment because we had some water damage, and so we've had our whole room stripped out. So I'm Laurel. For those of you who don't know me, I'm Laurel George. I'm chair of the Waitemata Consumer Council. And we are currently looking for a consumer advisor to represent the Rodney area. We did, when the council was formed in 2019, have an appointed member in this area. But in 2020, she had to step away for business reasons. And we have been wanting to reappoint in that area for some time, but with the changes with the new health system review, we hesitated to do that. But we now have certainty that consumer councils will continue in whatever guise that may be, and whatever we might look like. We've been told to, or advised to, continue to appoint where that needs to be done. So we are now searching. Tracy did circulate documents on our behalf. Thank you, Tracy, some time ago, and we are getting close to a close-off date for that. But I thought Tracy and I thought this was a good opportunity just to bring it to your attention. And so we know all you lovely people are in West Auckland, but we thought you may have some connections in the Rodney area. So I guess we're looking, you know, kind of north of Long Bay, wherever those council changes occur. So sort of Wongaparoa and around that area and north until it gets up into Northland. So just a little bit, very quickly, Waitemata Consumer Council formed in 2019, as I mentioned, and the council's remit was to develop effective partnerships in the design, planning and delivery of high quality, safe and accessible healthcare services for the Waitemata community. Currently, so as a Consumer Council member, you represent the voice of your communities to help improve patient experience and health outcomes. This role is to shape and support strategic decision-making work alongside senior leaders at Waitemata. So currently we are 11 members on the team. We obviously wish to appoint that member in Rodney, and maybe over time we might increase that as well. And we had a student member last year whom we're hoping to replace this year as well. He has moved off to university now and is unable to be with us. So just briefly, what we consider about the role of the consumer advisor. It's a voluntary based role, initially appointed for 1 year. There are 8 meetings a year, for which there is a small payment stroke koha. You will receive excellent support from the team at Waitemata. You will help oversee data and evidence related to consumer engagement activities at Waitemata. And your experience and expertise will support patient-centered, high-quality healthcare that matters to people in our community. You will then advocate for service and building design that supports better access in the health system. So just briefly, and not all the way through, because this is also in the papers that Tracy sent out on our behalf and are available for us to send out to you again, to anyone that you might like to recommend applies for this role. We see this advisor as a community-minded person with a connection to local communities and networks in the Rodney area. And with the following attributes: respect for Maori as tangata whenua and Te Tiriti o Waitangi as our nation's founding document. Live our values of everyone matters, connected with compassion, better, best, brilliant. Advocacy expertise developed within communities facing inequitable health outcomes or cultural safety issues in the health system. That is Maori, Pacific people, youth, people with a disability, LGBTQI+, or migrant, Asian and refugee communities. That this person enjoys building strong relations through effective collaboration. And I guess also to be able to work as a team of people sitting around a table working for the same common purpose. At Waitemata, we strive towards health equity and strongly encourage applicants from Maori and Pacific communities, but not only Maori and Pacific communities. We value the rich diversity within the population we serve, Waitemata serves, and we welcome applicants from diverse backgrounds. I could prattle on. I don't know how much time I have, and I know I'm over my time and late. I would perhaps just add that aligned with Payora, the Healthy Futures Bill, which aims to protect, promote and improve the health of all New Zealanders to achieve equity by reducing health disparities. The Health Consumer Council focus is to provide strategic advice to the executive leadership team, the senior team now sitting at Waitamata. And because of all these changes, they've now changed their name, but whatever the new team will be called, the executive leadership team, ensure that patient community voice is heard by those providing health services at Te Wharaora Waitamata District, to inform the design and redesign of health services, inform decision-making about safety and quality, review patient, whānau and family feedback data, and improve patient, whānau and family experience. Through meaningful partnerships across Te Wharaora Waitamata District, the Consumer Council provides a strong, diverse voice for the community and consumers on healthcare planning, quality improvement, and the delivery of services that meet the needs of Waitamata District's population. And I think that's probably enough from me. I'd be really pleased to take any questions that you had.
Thank you, Laurel. We'll give a couple of minutes for any questions. And as you say, I saw one in the chat actually from Trish, and it was about, does that Rodney district, does that include, I think it was Helensville and Parakai that I read?
Trace, I'd like Tracy to answer that. I think, Tracy, does Helensville and Parakai come under what, the West?
Ooh.
Because they're Rodney, right? So.
Yeah, I think that'd be Rodney. Yep.
Yeah, and the vacancy is for a Rodney representative.
Yep, someone representing. Now, we know it's a very wide and diverse area, but, you know, starting with this kind of all-encompassing Rodney kind of area.
I just feel mindful that we need to really represent Rodney well, not just kind of, I just feel like morphed into the North Shore. That's just something I'm feeling. Yeah.
Hi, Trish. Not morphing into the North Shore. On the Consumer Council at the moment, we're split about half North Shore and West. At the moment, we only have one space that we can fill for Rodney, and we're conscious, like I just said, that it's a very vast area. As we have more clarity around consumer councils where they're going, and as the funding pool is confirmed, we're still waiting on those kind of that information to come from Te Wharaora. At the moment, our funding pool is as it is, and that space is only for one more advisor. So it's a starting point for Rodney, and absolutely acknowledge that one person can't represent the whole of Rodney.
Great. Kapai. So does that provide some clarification? Hopefully. I'm not sure. Kapai, Tracy, just checking in with you.
Yeah, so I think, you know, Laurel's trying to, you know, get that Rodney voice, and if there's anybody who has really good connections, even if it is Helensville, that, you know, reach up into the Wellsford area, you know, through all these NGOs online, they might know of somebody. So Laurel, if you put your contacts in the chat,
yep,
and anyone who wants to know more or have got, you know, someone they might think might suit, then yeah, just email Laurel.
Please be in touch with me. That would be fantastic. Thank you. I appreciate your help, and thank you for the time this morning. Thank you, Tracy.
Okay, kia ora, Laurel. Thank you very much. So in terms of our agenda, I just noticed that some people have had to leave, and we totally understand that. Yeah, if that's the situation for you and you've had to leave, I'm just noticing that people are saying thank you and are saying goodbye. So kei te pai, and there've been people joining as well. So we have one more agenda on the item. It's an update about the locality planning for West Auckland, and Dr. Lance Norman, the Director of Health Reforms for Te Whānau o Waipareira and the Whānau Auto Commissioning Agency, has sent through an update. So we will share that and open for questions. But before we do that, because this is pretty amazing. We're a little bit ahead of time. I just want to check in. I noticed that some of our GP practices have joined us here. So if you're from, I think it's Jason from Swanson GP practice. I think maybe one of our osteopaths is also here. If you can just raise your hand, please, just so that we can see you. If you're still in the room with us as part of the meeting, and anyone else who's from general practice, anybody else, we've heard from the staff this morning, some of the staff, about the value that they, you know, are looking for from this space, from this community meeting space. Kia ora, Matthew. Welcome. Great to see you here. And Jason is on the phone, which is fine. Anybody else from a GP service, please just raise your hand. And we want to say welcome, Matthew. And if it's okay with you, just a couple of minutes about, you know, from your perspective, when you come to community health meetings like this, what are some of the value or the things that you're listening for or wanting to share in this space? Thank you, Matthew. Welcome. Putting you on the spot there.
Yeah, thank you. Kia ora. Well, this is my first time being in a meeting like this, but it's just the number of services that are out there. So that's very good to know. Also putting faces to organizations, that's very important. You want to have a connection point to those organizations, and that they're there because when most of our members, so I'm a member of Osteopaths New Zealand, which is the peak performance or peak representation organization for osteopaths across the country. There's only about 550 osteopaths in New Zealand. I'd say about 80% of them are a member of our organization, but we're typically working in small practices. There's a lot of solo practitioners, so they're often in a room, you know, working by themselves with one person at a time. Usually it's not group work. So to know that you've got people around you in the community that you can refer to in their area of specialty, expertise is very good. So we know that there's a wider team, and certainly osteopaths like to work in that wider team. Yeah.
Thank you. I'm going to shorten it to thank you, Matthew. Please keep coming back. Great to have you here today. Kia ora, thank you. It's valuable feedback. Jason, welcome.
Hello. Hi. Thank you very much for inviting me to this meeting. This is actually my second time attending this meeting. And I am so pleased to see everybody and all the services that we have here in West Auckland, especially for our patients. And I couldn't thank you enough for all the services that you give and support that you give to all the people in the community. And it's quite important for me to attend this meeting as well, because as a practice manager here at Swanson Medical Center, it's important for me to know what are the services that we have that we can offer our patients that I am not aware of. And actually, I just realized how many we have at the moment. So that's all for me. Thank you very much.
Kia ora, thank you very much, Jason. Please continue to encourage your colleagues to come and attend in this space. It's a really compact space. So many services that you can hear from really quickly. Great feedback. Thank you about how you use this service and how important it is to put faces. That's the other thing that Matthew said, put faces to organisations and names. So organisations and kaimahi out there, if you want to contact these two, you know, use the chat box, use that space that we have in this time that we have now together. So moving on, Tracy, we're doing well. Is that okay now if actually we have someone in the background who's Ben, who's doing all our tech, right? So when you see things shared like they are just now, that's our Ben. Thank you, Benjamin, for that support. And I also want to just say that Tracy does a lot of background work. Yeah, this is all Tracy's mahi. This is all of her work. So she has been following up with Lance Norman, who came and presented at the last hui. And so this is his update. He couldn't make it here today, but what we will do is we'll share this update with you, and I'll just read it. What we'll do is we'll open up the chat box to record questions that Tracy can pass on to Lance. So, ka pai. So here it is from Lance Norman, is that he has been meeting with providers since he last met with us. They are doing a health needs assessment for West Auckland using a collective impact model for our locality. So they're meeting with locality prototypes, and they're sharing information and learning from that feedback. And there's an acknowledgement that the change management has been very slow, it says. So we've been in communication with Whatu Ora regarding localities, and there's some feedback response below. He also says that he is available to present to organisations, so please reach out if that is useful and helpful to you. Thank you, Ben. If we could have the next page, which says that, you know, we're working with the 12 locality prototypes and testing, learning, sharing information, including locality plans. By the hope is to capture those key learnings to develop the plan even further across the motu, across everywhere, the island. So a very strong focus on relationships. That's the advice, the strength and breadth of relationships across organisations, and what we know about Waitemata and West Auckland, that we're very strong in that area. So key local solutions for local challenges, and also they are continuing to identify stakeholders and important relationships that support the vision. There's a bit of a reference to not worrying that everybody will belong to a locality. There's a time frame there of July 2024. There's a website there to check anything out, and so that is the update. It's signed by Kylie and sent through by Lance Norman. So that is the update. Thank you, Ben. Thank you, Ben. I just want to check in with Tracy and notice if any questions are coming in the chat box, because I have not been looking at the chat box. Kia ora, Tipene, thank you. Tracy.
Yep, I think we're done. Thank you for everyone that came. It's just amazing. I've had a few hiccups in the background and I've been on the phone, and so, but otherwise you make it look very calm.
Can I just come in here, because we've finished that. Over the period of the terrible things that have been happening for the last few months, as you know, I give out a lot of information to a lot of people about the different groups. And I was a bit dismayed by how many of them have not got the right contact details. Somebody has left, they've been replaced, the emails are bouncing back. Can you all please make sure that on everything you're putting out and on your emails and on your websites and everything, you have your current up-to-date information for contact?
Thank you, Kay. And a request to update your information. Fantastic. Kia ora, everybody. I am going to close the way we started with karakia, and absolutely acknowledging the your attendance and the value of this space where we can come together across sectors to share information face to face. This is kind of what face to face looks like these days, isn't it? It is on Zoom. So holding in our hearts all those people who are still dealing with the consequences, the implications of floods, of cyclones, you know, of being unwell as well within that dynamic of our world at the moment. So as we offer thanks, I'm just looking at Zari, and I want to acknowledge you, Zari. Thank you. Right in the middle of my screen, so that's for a reason. So as I offer karakia, thank you very much, everybody. We will continue to send up the updates. We hold you all in our hearts and the work that you do. Me inoi tātou, kia tātou katoa, te ata whai o tō tātou ariki ai hukaraiti, me te aroha o te atua, me te whiwhinga tahitanga ki te wairua tapu, ake, ake, ake. Amen. Tēnā koutou.
Thanks, Animoa. Bye, everybody.
Bye all.
Thank you.